Hey guys, Dr. Ben here, FA Well Centers. Excited to talk to you today about your questions about anything that you've got going on that you want to reach out about. Glare was a little much there. Let me actually turn this one this way. Try that. So here's the deal. Well, first question. A lot of you guys are asking what happened to my cheek here. So we had some wind the other night, about 80 miles an hour, and I had cardboard set out from Christmas. And the cardboard, as it was starting to blow away, as I picked a piece up, this and hit me in the cheek. And there's my war wound for the. Actually, let me do this. Okay, so bring your questions. Love having you guys on. Bring your questions down below. Cindy, what about glossitis? Give me some context about what you're asking there. Carla, great to see you as well. So ask your questions, anything you've got. We've been getting all kinds of questions this week. I'll start out with a couple. I had a patient that, or actually not a patient, but someone he direct messaged, and he was asking about information about his kids, and the kid's mom wants to get them their shots, and he does not. And so, it's really interesting how, there's so many things that are dividing our country right now, and it's pretty darn intense what people are going through. So obviously that's a personal decision between one's healthcare team, as well as what they feel their kids can handle. Suggestion for sore throat. So Cindy, sore throat, if it's a chronic sore throat, a couple things that we can look at. It can be a sinus drainage thing, that it can drip down into that throat over and over and over again. And that can be a big part of where the problem's coming from. If we have chronic sinus issues, you've always got to look into mold in your house, mold in your office space, anything like that. That's a very common cause of that chronic drainage in there. So look for that drainage. Otherwise, if you're getting recurrent strep throats, we had a lady a couple of years ago, she was getting strep throat every single month, and we got her within the first 30 days. She did not have strep throat again and has been doing great ever since. So you've got to look for those underlying immune deficiencies, and those can be a huge part of healing this process. What's good food to eat every day for thyroid health? Iodine can be helpful. So if you, Susan, thanks for the question. If you're eating kelp or sea salt, anything from the ocean like that has iodine, that's really nourishing for it. Taking selenium is a good nutrient for that. And again, when you're talking about thyroid, you got to also look at, why is the thyroid deficient in the first place? And is it Hashimoto's? Is this an autoimmune thing going on? If it is, then you've got to eat to stabilize your blood sugar, and that's going to be a huge part with any autoimmune condition. You've got to keep that blood sugar as steady as possible. And with that also, you've got to look at some of the different things to get your vitamin D optimized. That's going to be a huge part for autoimmune and Hashimoto's. So getting out, getting your sun, but also eating enough foods that contain vitamin D, and then even supplementing your vitamin D as well. Hey, Tanya, I'm in Knoxville. Often share your videos with friends. Very helpful. Thank you. We are, if all things go as planned, we will be open up in Knoxville in 2022. Gallbladder issues and treatments, please. Paula, did you get our email? So if you're not on our email list, send us a direct message or leave your email down below. And we just had a great gallbladder email sent out in the last couple of weeks, and Brittany can get one of those to you. But let us know, and we'll make sure that you're on that list. We had another email go out this morning. If it did not get into your inbox, check your junk mail. That's where mine ends up sometimes as well. So gallbladder issues and treatments. So gallbladder, especially in women over 40, is a very, very common issue, and it gets sluggish. We've got this sludge in there. It can get stones. All types of different things can happen in the gallbladder, and that bile is really, really important. So think about digestion, and you've got to start with the upper and go down to the lower. A lot of people, they just start with the lower and say, I need magnesium, I'm not pooping, give me some Miralax, some aloe vera juice, some different things. And why are we not having the bowel movements like we're supposed to? Well, a lot of times it starts up top. So you've got to start with chewing your food. And if you chew 30 to 40 times per bite, you're going to cause your body to secrete enough stomach acid, your bile to start being secreted from your gallbladder. A lot of good things are going to happen if you chew enough, if you're in a relaxed environment. And then it gets down into the stomach, and you've got to have enough stomach acid. And then from there, you've got to have your gallbladder working as well as you should. And that gallbladder releases bile. Bile is what's going to break down fat. So if you go and have French fries and a Frosty at Wendy's, and you feel this pain, this pressure, just yucky under the rib cage, things like that, that's probably a gallbladder issue. The gallbladder, this is one of the most important things you can do. The gallbladder really repairs itself between 11 and 1 every night. In traditional Chinese medicine, that's when that gallbladder is most active. So a lot of people that are staying up too late, that are staying up past 11 o'clock, are having gallbladder issues. So that's one of the first things I would look at, Paula, is getting to sleep before 10 o'clock, and that could be a huge help for your gallbladder. I would also look at doing a gallbladder nourishing, and don't have to think about it as a purge or a cleanse, but you can do things like shredded beets and lemon. And so you shred up beets and put those into just a cup, and then you take a scoop of that multiple times a day. Send us a direct message and I can get you a recipe for that one. And for some people that have had their gallbladder removed, or even people that have a really sluggish gallbladder, they need to take bile salts. And so, Brittany, that's the Bile Man. You can put that link down below. And so it's basically an enzyme for your gallbladder. So you've got to get that working better there. Susan, know much about hand, foot, and mouth. My grandson has it, and I've never seen it. So again, just like any virus, any bacteria, you've got to look at the quality of the host. And usually, because you could have 20 kids that all get exposed to that, but not every single one of those kids is going to get that disease. So what is going on? It's the quality of the host that is the issue, and it's not just, oh, everybody gets it. So I would look at his gut health. Has he been on a lot of antibiotics? Was he breastfed? How long was he nursed? Has he had a lot of strep throat, ear infections? Has he had antibiotics? Is his gut out of balance? Is there eczema, other inflammatory signs and symptoms? Then we've got to go down that path of, okay, we're going to really build this back up and start getting his body as healthy as possible. So that's the biggest thing I would look for that one. There is no magic fix for it, but you've got to look at the quality of the host. Cindy, been diagnosed. How do I know if it's yeast or bacterial? I know linked to B complex deficiency. What tests should I do? So is that yeast or bacterial on the throat? I'm not sure what you're diagnosed there. Krista, hey, so I have a question about my skin. I have white spots on my trunk area, chest and shoulders. Afraid it will spread to my face. If it's a yeast problem, does that mean it's coming from inside out? Can I treat it topically? What to use? Yes, and that's actually where I was going to go to first there, Krista. If we're seeing skin issues, think of two things. One is hormones, the other is gut. So first thought is go to your gut first. Stick out your tongue, and if you've got white coating on your tongue as well, very good chance there is a gut microbiome imbalance. You've got yeast on the inside, and you're going to need to do kill off. I love the ADP. Brittany, you can pop that down below. It's an oil of oregano. You've got to kill that off, and then you've got to build it back up with the probiotics. It's usually a little bit more in depth than just, oh, kill off, put good bacteria back in. There's other systems that are out of balance, I guarantee, in your body to allow this to happen. So you've got to start there, though. But you got to look at your blood sugar, and if you're letting that blood sugar spike up, it is going to cause that yeast to be fed, and it's going to give it those underlying building blocks to spread itself and to go around the trunk and throughout the body there. Topically, yes, you can do some tea tree oil, put that into some lotion. Coconut oil has some great anti-yeast, antimicrobial properties to it. So you can put coconut oil on, some things topically, but topically is not going to fix that. You've got to get inside, liver, gut, the blood sugar, microbiome, all those different things. Hey Charlie, great to see you. What type of test do you ask for to get the most comprehensive COVID antibody results? Brittany, go ahead and pop down Vibrant, a link to Vibrant. So we use Vibrant America as our blood test. Anybody that comes in from around the country that uses our services, we use Vibrant America. They have I've used this test since like April of 2020. Still the most comprehensive COVID antibody test out there. It's looking at IgG, IgM, and looking at multiple different types of antibodies. So that is the best one out there that I have seen. Most of those quick ones, or the ones you get at Walgreens, I'm not quite sure on those. Tracy, sick with COVID right now. Do you advise the home OV treatments? OV, so not quite sure if you're saying IV treatments instead of OV, but let's talk about IV treatments. So IV treatments, you can get vitamin C, you can get Myers cocktail, you can get ozone therapy, all types of different things. And so, yeah, that's great. If you have access to a mobile unit in your community, and somebody can come and get you some IVs, or you could even get to that facility, that would be great. Just to nourish that body. A lot of times that pulse ox starts going down, the body starts getting depleted. So giving it, here's what I would look at. If you can get a glutathione IV, that would be great. Glutathione, NAC is the precursor to that. So we need more glutathione. So glutathione IV would be great. I'd get vitamin C IV. And if it gets bad enough and you need more support, the monoclonal antibodies would be another step if you need to go down that path. So those are some great tools that you can do there. Good morning from freezing Pueblo. Yeah, I think winter finally came. We're going to get some snow on Friday. Actually, first snow of the year here in Colorado, which is crazy. And -6 for a low. So Tracy, 6 with, IV treatments. Yep, we talked about that. Alyssa, what can cause middle of the night panic attacks? Hardly ever get them during the day. Easy. This is great. Glad you asked this one. So think about this. Every time your blood sugar goes down too low, the adrenals get revved up and they tell the liver to kick out glucose. So low blood sugar causes adrenaline to go through the body. We see this all the time. If somebody wakes up in the middle of the night, and if this is you out there, think about this. You've got to stabilize it. Your heart rate's going. I have women, they'll put down a towel on their bed before going to sleep, and they'll wake up just drenched and then take that towel off. They have to change their clothes. They wake up panicked. They wake up with their mind racing, can't get back to sleep. Number one reason why is if your blood sugar is out of balance. So if your blood sugar dips in the middle of the night, it's going to cause this adrenaline spike at that time, and that's what you are feeling. You are feeling these panic attacks. We call it random anxiety. Some people, it happens during the day, but a lot of times it's at nighttime. So what do you need to do? You need to stabilize your blood sugar as much as you possibly can all day long. If you need to, have a little snack before bed, a little bit of like turkey breast and cheese, avocado and some turkey. You could do a little slice of apple and a scoop of almond butter, some fat, some protein. If it's carbs, some simple or complex carb in there, no simple carbs, and see if that can help stabilize it. But ultimately, you've got to fix your blood sugar the rest of the day. Almost guarantee there, Alyssa, that you are going hypoglycemic throughout the day. Chrissy had COVID back in May and still do not have taste and smell fully back, maybe 50%. Anything that can help. Dosage. That's a tough one. Between that and chronic hair falling out, let me know if anybody's hair is falling out. Put that down below. We see that all the time. And what we see with the taste and smell, the easiest thing to start with is is doing high dose zinc, like 100, 125 milligrams a day. And some people that will bring it back. Some people have talked about on this feed that they've gone and gotten a chiropractic adjustment, especially in upper cervical, like C1 adjustments. If somebody specializes in that, that can help take that pressure off the nose and that nerve in there. So could be that you do some cranial work if you have a massage therapist or cranial therapist that you could see as well. That could help take some of that pressure off those nerves there. I've been sick for 17 days. I'm on Covet inhaler, Z-Pack, prednisone, Mucinex. I've had COVID, but it's been 17 days. My doc won't call me back. So is this COVID or you've had COVID in the past? So Joe, if you're still having these symptoms, even 17 days into it, you'd have to look into the monoclonal antibodies. It's a little bit late for that, but if it's still dragging on, then you've got to push through on that. We had posted an email a few weeks back on some different stages and different medications and different things that doctors around the world have found helpful for these situations. So if you did not get that email, well, one, if you're not on our email list, go ahead and put that down below or send us a direct message with your email. We'll get that on there. But if you didn't, just send us a direct message and Brittany can get you that information sent over. And vitamin D levels seem to play a tremendous role in our health more than anything else. Why? Vitamin D, one of the big things that vitamin D can do is modulate the immune response. So it can turn it up at the right time and turn it down at the right time. So especially when we're talking about autoimmune, if we're just turned up all the time, we're not going to be able to calm down and get rid of this major immune response. If we are too low, that's when you can get COVID, you can get immune system issues, flus. That's why we give people 50,000 a day for 3 days boost when they first come down with something. So vitamin D absolutely a huge thing. Could inflammation in the body play a role in stillbirths? When we're talking about stillbirths or miscarriages, anything at all, as far as pregnancy goes and not being able to get pregnant, maintain pregnancies, have live birth babies, there usually is some type of inflammatory state going on in the body. And so here's the deal. If somebody can't get pregnant, it's a third of the time is mom, a third of the time is dad, and a third of the time is both mom and dad. So that's why if somebody is trying to get pregnant, very rarely will I just work on mom. I'll tell them, I'll work on you, I'll get you as healthy as possible. I'm not going to guarantee you're going to get pregnant because there's a 50-50 chance that it's the husband as much as it is the mom. So a lot of times it's going to be both. So maybe sometimes it's even how those genetics come together. And so dad, think about this, the lion waits for the female, the male lion waits for the females to do the kill, and then the male runs in and gets the best eating and then goes off. He doesn't sit up on the ridge drinking beer and watching TV and getting fat. He's got some of the best nutrients out there. So as a male, our sperm quality, our testosterone levels, which we've talked about a bunch here, testosterone has dropped 50%, sperm count has dropped 50%. So the quality of that sperm is less than it should be. So absolutely, you if it's you, Christy, or the loved one, you just need to go through the process of fixing whatever's out of balance. And that's what we do with everybody. It doesn't matter ultimately what their symptom is. We just have to go through system by system by system and fix those. Are you able to help people with Parkinson's? What kind of diet, exercise, supplements? Is Dr. Bird's keto good for me and my tremors? Parkinson's is a tough one, and I feel for you. We've had lots of Parkinson's patients. Depends on what stage somebody is at. If it's a late stage Parkinson, it's going to be very challenging for somebody to get massive shifts. If it's an early stage, absolutely. Try a keto diet. That there's definitely certainly neurologic changes that can come from there. Try support for dopamine. There's specific exercises that can be really helpful. So yes, there's a lot of things that can be done for Parkinson's, but kind of like Alzheimer's. Late stage Alzheimer's, a lot harder to work with than early stage Alzheimer's. But unfortunately, a lot of people, early stage Alzheimer's is 20 years before they actually get diagnosed with Alzheimer's. So it's really about just doing everything day in and day out that's going to be best for that. Hey, Michelle, what do you recommend for treatment of neuropathy in your feet? So number one, you've got to figure out why you have neuropathy. Blood sugar, chemo, low back where it's pushing on those nerves, or idiopathic where we just don't know. The most people are going to be from blood sugar issues. So number one, you've got to stop the damage. You've got to stabilize that blood sugar, reverse your diabetes, reverse your insulin resistance. Totally doable. You just have to move your feet that way, and then you can start with some of that healing. There's some different machines out there that run current through the feet that we have seen great improvement from. If you want some links for that, just send us a direct message. But ultimately, you've got to fix the why. There's no amount of machine. There's docs and offices out there all over the place that are having these $5,000, $6,000, $7,000 programs for neuropathy, but they're not fixing the why. And so all they're doing is just trying to stimulate these nerves, but they're flaccid and they're deficient and just not working like they're supposed to. So you've got to fix the why first. Andrew, thanks for the share. What if there is no gallbladder? Suzette, that's where you do the bile salts on a regular basis. If you're having digestion issues still, look to those bile salts. Send us a email or direct message, and we can get you a link. We'll put that in full scripts for you. But the bile mint is great. Yes, I answered that. Lingering cough from pneumonia. What could I take or do? Debbie, getting regular exercise. You've got to exercise those lungs. You've got to start clearing that out. Getting blood flow into there. So even if you have a stationary bike, just getting some movement, just getting enough to where your body is starting to get some flow in through there. And if you need to, short-term use of inhalers or things like that could be beneficial as well. All right. Yes, first person brought up masticating enough since I first learned that in the late 70s or 80s. Thank you. Trust me, folks. It's far better for total body health to chew at least 32 times each bite. There we go. Thanks, Rhonda. It also slows down how fast you eat, which would give better absorption. Amen. I would rather you eat less calories and take longer and absorb those nutrients than eat a big meal, eat it fast, and not absorb like you need to. How do you know if you have fungus in your body? Look at your tongue. If you've got a white tongue, very good chance you've got some yeast. Yes, Cindy, we can give you a link for that one. Any contraindications for doing both monoclonal antibodies and ivermectin at the same time if my parents were to get the virus? What do you think about monoclonal antibodies? So I have not seen any negative with both of those. I mean, those are both the ivermectin. It's a very benign product. People use that for 70 plus years all over the world. They call it Sunday. They take it every week all over the world. No issues with that. What do you think about monoclonal antibodies? I've had multiple friends that have used it very successfully. Do you have any tips for lifting weights with a sore hand? So if you got a sore hand, you can do some bands, and if you hook the bands onto your wrists, you can do that way, and even do some things where you're pushing more through here as opposed to onto the hand. You can do more leg exercises, lunges, squats, things like that if you're not able to push on that hand. I had injured this knuckle pretty intense in the last couple months, and so I've had to modify a few things, but ultimately getting some rehab, doing some therapy to get that strengthened is going to be better. It's going to take a while. Talking from my experience, my doctor won't see me for a post-hospital COVID pneumonia stay, so I'll have to do a walk in the clinic. Yes. All right. You know what, guys? I am gonna jump here. Thank you so much. Any of these questions that are still on there or that you're putting down below, we will answer today. So just keep putting questions down below. If you're watching this later, put the questions down below and we will get to those. We will answer those questions. So love having you guys on. If you did not get our email, if you're not on our email list, pop that information down below or send us a direct message. And remember, on Thursdays when those emails come out, check your junk mail because sometimes it does go there. All right. If I don't talk to you again before New Year's, I'm going to try to jump on tomorrow. But if I don't, Happy New Year's 2022. This is your year, guys. You've got the ability to get as healthy as you possibly can. So make it a great day.